who loves durians.
Yes. Speakers. The first speaker is Dr. Sarbjit Singh. He's the Chief Ophthalmic Surgeon and also the founding medical director of Dr. Shamsjit Singh Eye Hospital in Punjab, in India. He has produced many video presentations, both locally and internationally. And he has an ophthalmology YouTube channel. For those of you who don't know Sarbjit, he has a very, very strong Malaysian connection. His wife, Sharon, is from Kuala Lumpur. And the second connection is he has spent 3 years in the early 1990s in Sarawak General Hospital in Kuching, and we share many great times together. I invite Dr. Sarbjit Singh to present his talk. Thank you.
Thank you so much, Dr. Dennis. That was a very elaborate introduction. Thank you so much.
Welcome.
And yes, I had a lovely time in Kuching, the 3 years that I was in Kuching. I really had a great time. Can you guys see me?
Yes.
Okay, all right. Today, actually, I'll just emphasize one thing, that this is a basic 101 course on video recording, editing, and presenting. And those of you who are pros at it, please excuse us because we are going to touch only the basics, which I think are very important. The other day, Dr. Chan was telling me that not many people, especially in Malaysia, many ophthalmologists, I think it's true all over. Even in India, they are not recording their surgeries or their videos, which I think is quite important. So today, my aim is to familiarize those people who are not recording to the importance of recording surgical videos. Why do we do it, and how are they going to help us as ophthalmologists and otherwise. So we will be talking about recording, editing, and presenting. All, as I said earlier, it is all the basics of it. First thing is, why do we want to record our surgeries? First, of course, we document everything else. Why not surgeries? We record our histories and all those things, and we should be doing documentation of surgeries as well. And then, of course, for medical legal purposes, we need to keep these video records in case of any issues. And then we need to present them in webinars like today, or we have to present them in academic conferences and meetings, and then for teaching. But I think the other day we agreed, Dr. Bond and others, that the most important reason is self-audit. That means we must watch our surgeries. Every surgery we must watch once or twice, because we are going to find a few things which we actually didn't notice during surgery. Especially when there is a complication, we will know what happened, where it happened, and why it happened. And if we can't figure it out, we can actually show it to one of our colleagues, and maybe he can find out what went wrong. So I think self-audit of your surgeries is very, very important, and you learn a lot. I think I've learned maximum from criticizing myself, in the sense that when I see surgeries, I said, oh, I could have done this way. That wasn't very clever. So I think self-audit is one of the most important reasons to improve ourselves as surgeons. Then when we record videos, we must keep in mind that they should be clear, they should be sharp, and they should be very well centered. Otherwise, we are not going to get much of information from them. Usually, whenever we show a good photograph, even not related to medicine or sunset or whatever, and of course videos, the first question they ask you is, what camera did you use? Actually, camera is a small part of the whole jing bang. So in this case, we have the microscope, we have the beam splitter, we have the adapter, and then we have the camera. And all these actually use lenses and glass, which has to be very good quality. If we have good quality microscope, good quality glass in the beam splitter, adapter, and then the camera can give you a good quality video. Otherwise, if the glass in other things like microscope is not good, or even it's not clean, your video is going to be rubbish. So there are various camera systems around. I'll be basically touching upon three of them. One is a mini camera which comes built into a Zeiss. That is what I'm using. Then there is a CCD camera with C mount. We can even get some CCTV cameras, video cameras. And then the latest and probably future proof if we want to do is a DSLR with adapters. So I will show you a video maybe at the end of these three or four more slides, and I'll show you all these three different kinds of video systems. So another thing which I would like to emphasize is the video overlay device, which I'm using, and I've been using it for many years, and this has been a great help. I've not seen many people actually using this, but I think this has got a great importance. If you add this to your recordings, it doubles or quadruples the value of that. And I'll briefly show you a 1-minute video on this as well. And then besides that, the other things we need is like a video capture card. Video capture devices are actually just devices which convert the analog signals from the camera to digital signals, so that those digital signals can be recorded onto hard drives or pen drives or onto your computers, so you can manage those videos. So these are just that. So some of them are just converters. They only capture the videos and they transfer it to your computer. And there are others which actually they record them also. And the ones which record them, in those cases, you don't need a PC or a Mac near your surgical setup. Then, of course, you need hard disks or pen drives where you want to store your videos. And of course, computers and PCs, either to record the videos or later on to edit videos. So once you have recorded the videos, we need to archive them. That means you need to save them. And the real suggested method is to store them at two places. One is at the site and the other is off-site. Just in case if something goes wrong, like a fire or something, you don't lose both your copies. So that is a way actually to store your videos. Then comes a time when you need to edit those videos so that you can present them on meetings or teachings or wherever. So there are many programs which are video editing software available for different platforms like Windows, Mac OS, Linux. You get free ones and also you get paid ones and professional ones. My usual go-to video software is Final Cut Pro, which is actually a professional paid software. But for usual videos, I use iMovie, which comes with Mac and it's free of cost. And it's pretty good for most of the work that we as surgeons need to do. For Linux also, they have DaVinci, which I think Dr. Bond will be touching on. So these are the software which are easily available. And they can, basically all of them work on similar principles. If you know one, it's not very difficult to use a different one. So I'll be showing you a small little video which is on movies, which will be editing on iMovie of video recording. The first one is Zeiss Mini SD camera. Here you will see that this is my setup where I'm using a Zeiss OPMI FR Pro microscope, which has got a built-in mini video camera. This is quite a small camera actually. And the focusing also can be controlled from here itself. From here the cable goes into the analog to digital capture device, from where it goes to my Alcon high definition overlay system, which allows me to see my Centurion phaco settings on my monitor as well as on the video. From here it goes into the Easy Recorder 130 through an HDMI cable, and then that is connected to a hard disk. So all recordings go into the hard disk, and that Easy Recorder is connected to the monitor through HDMI again. So I'll keep this short, quite short. So you must keep in mind that the people who have come to watch your webinar or whatever, they have their time is very precious, and don't waste their time. The same thing. The one thing which I don't like at all, usually in presentations, is white screen. A lot of people use it for various reasons, like putting up text and all that, like in this case, but it is so blinding, especially if you're in a dark room, in a hall where somebody is presenting. This white screen can be quite, make you photophobic, and it's not kind on the eyes, especially if you have to sit through the presentation for a long time. So I don't like white screens. I either use darker ones or even black, but depending upon what my requirements are. Like in this case, I find this blue quite soothing to the eye. So that is one thing. So there should be no distractions at all. Like I mentioned the transitions when we were doing the iMovie editing. Transitions here also can be very distracting. Just use very simple one if you really want to use. Otherwise, what we call hard cut is also quite all right. If you want to use, I use just subtle dissolve kind of a transition. Otherwise, I try not to use. So your video must have a message. It shouldn't just say phacoemulsification. No. What are you trying to show? Your whole video must have a message, like how to prevent dropped nucleus. Something useful for the person. Phacoemulsification is very vague. So unless you are showing it to very beginners in phacoemulsification as a title is, to me, no good. It has to make sense and keep your audience interested. Yeah, this is what I'm going to learn today. It won't be a wasted time, otherwise they can just walk out. So our videos must deliver a message. Again, the video should be very clear. It should be very sharp. It should be very centered, so that the person who is watching it knows what the recorder is trying to show you. Then be generous in editing your videos. Cut, whatever is not necessary, just cut it. If your time allotted to you is 3 minutes, I've seen a lot of people either going over 3 minutes or trying to make it 3 minutes, 59 seconds. If I have given my message, I would rather stop at 2 minutes, because that is what my message was. Don't go overboard. People, appreciate their time not being wasted. So as I said, make it short, like this word short. Make your videos short. They shouldn't be long. They should have a message. And then once you have done your video, you must summarize what you have actually shown, all of them, including you should actually add the patient's, what kind of vision the patient had, pre-op and all those things. If you add them, that adds interest to the videos. So if I want to summarize, it was like clear, attractive title, clear, sharp, well-centered video. It should have The video should be relevant to your title and your topic. It should add value to the audience. It should be as short as possible. You deliver a message, give it to them, shut up, get out. That should be the thing. And we must value people's time. We should start things on time, finish them on time, and then also thank people for their time. So I think I'm going to thank everyone who is watching this for their time. And Dr. Bond is going to add on to whatever little I said. He's going to expand on it. I'm sure he's going to do a great job. Over to you, Dr. Dennis.
Thank you very much, Sarbjit. That was a very nice presentation. Without further ado, I would like to invite Dr. James Bond to present his exciting movie.
Thank you, Dr. Dennis. Thank you, Dr. Sarbjit. That was a great talk. Both speakers, I must say, Sarbjit and Dr. Chan, it was a lot of learning from me. I think I've done a lot of videos, but there's always small points and tips that you can pick up. I think it's very good balance that you've achieved, Dennis, with this panel of speakers, because you've got the conventional parts all covered, and then you've got the bright ideas from innovation and innovative person like Dr. Chan. So I think it covers both aspects very well. So hopefully all the attendees can benefit.
By Dr. Sarbjit and Dr. Chan was really, really good. I also learned so much. Fantastic. Thank you, Dr. Dennis. Gee, whoever's listening in, this is fantastic in terms of getting you to think about these items, which, well, judges most probably will be, looking at in the selection of prize videos. Yeah. Essentially, I want to credit the APVRS 2017 organizing committee. I got some inspiration from the criteria for judging, or criteria for excellence. Yeah. So I think actually Dr. Sarbjit mentioned something really nice in his talk about what constitutes a good video. And I think those points are reflected here. Very quickly, I'll just go through. There are three main points. The first one is the technical points on the video. Okay. And the second one is the technical points on the audio, and there's another final one on the educational values. So really, as Dr. Sarbjit said earlier, we really want to share something with the audience, yeah? And so these points all really come out in the evaluation also. So let's look in detail at the sub-items. For the video itself, I think the overall quality or resolution is important. The clarity of the movements, yeah, how smooth they are, how clear they are. The appropriateness of the title, again, a meaningful, appropriate title for your video. Looking at your presentation layout, how you use the color, remember the tips given by the speaker, the designs, yeah, and how you choreograph, how you planned and organized it. Really, really like a video shoot, yeah. Next one is the technical points on the audio, yeah. So again, the overall quality of the audio, right? The clarity of your commentary, that it was easy to understand and clearly delivered, relevance and appropriateness of what you said, and the appropriateness of what you said for the surgery shown. The final one would be the educational value. How new or novel was the technique that you were presenting, and the overall educational value. And it's good to sum up with the learning points, and that constitutes 100 points. So this is from my limited experience and just sharing with everyone. Thank you.
Yes, Dr. Sarbjit, please.
Yeah, as Prof. May said, actually I had the honor of being one of the judges for All India Ophthalmological Society surgical videos, and some of them are really, really innovative. So I also, as she was elaborating on the points that we have to look for, and that is where I learned actually that these are the criteria that we must follow to give marks to the videos, and they make so much of sense. Otherwise, people were coming out with videos which had no head or tail, and those are just wasting people's times. That's not. They don't get selected at all. Okay, so that's very important. Second thing, before I forget, Dr. Bond was talking about transfer of files from iPhone to other devices. I want to mention it's off, what we are just talking about was, because this is a basic, like a very basic course we have tackled. But of course, we can get very complicated, and in the sense that you can have multiple cameras at multiple places, especially two cameras, one from the side view, and of course one from the one which is the surgeon's view through the microscope. Those two are very good because they show your intricate hand movements when you are doing surgery. Because sometimes I've seen some trainees who come and they say, you did this, but we don't know, we can't do it. But when they come to the theater and they watch, oh, you used your hand like this. So those two views are actually quite important. And if they can be done simultaneously, they are quite good.
Ask you a question?
Yeah, sure.
Based on, just following on with you having been a judge before, was there any other criteria you felt should be in our evaluation that perhaps was not in the list I presented? Or have we more or less covered it?
Which you have more or less covered all of it. Okay. But the thing is, I feel, and you might be knowing Dr. Namrata Sharma, who is a great corneal surgeon from All India Institute of Medical Sciences. She was my co-judge, and another one. Those are great guys and superb guys. We were discussing about it, and the first thing came to mind is which video actually catches your attention. This is like a sixth sense kind of a thing. This is it. So when you get that awe moment or wow moment, that is a video which is actually good. Then you dissect it. Why did we have this moment? Then of course those technical things have already been given to you, to the judges, that you have to, this thing is not there. But for me, this is very important. Once I feel, this is what I wanted to see. Yes, wow factor or X factor has to be there. Otherwise, all videos, most people are quite good at it. The ones who reach that kind of a level where only 10 videos have come out of maybe 10,000, most of them would be good. But I actually wait for that wow factor, which is going to give me a wow factor. I don't know, I may be right or wrong, I don't know. But this is how I've been doing it.
Yeah, comment?
Yes, my wife.
I think exactly what Sarbjit said, it's basically comes with practice. I think if you record your videos long enough, you know the area where that's going to look good on your video. So you consciously try to keep it there. Now, the problem comes in when you're trying to show techniques when you are doing complicated cases. So you're focused and then you're actually looking at where your things are going to be. You don't think about that. So what happens then again comes with practice. When you say, I want to show, then you look in a video and say, oh, no good, got to do it. Got to wait for another case to show a good one. So you try to make sure that you do it, and it just comes with practice.
Absolutely.
Right now, I think if there are no more questions, and if there's any things the speakers, any last comments from the speakers and the panelists? If not, I'll probably sum up. And any last?
I'll just say thank you to all of the panelists, and Dennis, especially to you. And out of just a small little talk, you asked me whether I would be interested in the webinar. That was so nice. Met Dr. Chan, Prof. May again, and of course, Benjamin and Dr. Lee. It's so nice. Next time I come, I would want to meet all of them personally. Probably I'll be coming in December, and hopefully by then the flights will be sorted out, and we can meet up again. Right? Thank you so much, Dennis.
I just want to thank the boss speakers, Dr. Sarbjit, for sharing your expertise, your tips and pearls with us. Dr. James Bond for his great innovation and creativity, and great input from Prof. May, Man Wai, and also Benjamin his help has been incredible. I mean, without his help and input and IT knowledge, I would not have been able to organize these meetings at all.